Hello, everybody. First of all, thank you, Albert, for the invite. Once we'd established the back and forward with the email going into my scam inbox, I'm here today. So it's great to be here, and it's so fabulous to be in a face-to-face environment as well. So today, the topic of choice was integrated care, a new model for dental education. So actually, it's really in line with what we've been talking about, of the things we're discussing specifically regard to dental education and workforce. So just before we start, I don't actually live here at the moment, but I'm so excited to be back in my home city. So I don't know if you know that Glasgow is the world's friendliest city, so I hope you have been welcomed by the Ouija's. And it wouldn't be fair if I didn't give you my top tips. So I studied, and there's a few familiar faces that I went to uni with, but I studied at Glasgow. If you get a chance, pop to Sauchiehall Street and see the contrast between the dental hospital and the Hogwarts-looking Glasgow University is a stark contrast. Kelvin Grove Art Gallery Museum, if you get a chance, pop over there. It's beautiful, really nice architecture in the West End of Glasgow. If you get thirsty, you have to try Iron Brew. One thing I miss in London is on the left-hand side is Pizza Crunchy supper. If you've not had it, it's fried pizza. Please try it. And if you're lucky, you might see a haggis. Now, if anyone does want to see one, please come talk to me after, just so we can have a quick discussion about that. So in terms of the title today, it's such a fantastic title, Inclusion, Integration and Innovation, because I think that is what we need within our profession, specifically coming back from the pandemic, and we want to build back, and we want to build back better. In terms of the eyes that we've had throughout the course of the 2 days, I unfortunately wasn't able to come yesterday, but really amazing speakers. Innovation, inclusion and integration, but I've added on an additional one, which is inter and intra-professional working, which is something really relevant to what I'm speaking about today. So I want to bring you on a journey, go back the way, rewind a little bit, life before COVID. The things that we're seeing in the media just now, specifically with regards to dentistry as a profession, it's not new. It's something that has been there before COVID, but COVID has amplified and enhanced that. This is a quote from the British Medical Journal. It's the Quality Assessment in Health. And as a principle, oral health services should be acceptable, efficient, accessible, equitable, and relevant. And I think that it's really important that we don't misinterpret that accessibility. It's also the access that we need, or our patients need, to care is adequacy. We need to treat patients in the right place at the right time, with the right funding, with the right resources, to deliver a quality of care for our patients, which they are looking for, and with the right workforce delivering that. So 2019, I was working in this, and I still am, in the red area there, that's east of England, and we were looking at a lot of the access issues and concerns at that time. BDA article on the right-hand side titled "The Perfect Storm, the 4 million being failed by NHS dentistry." Now, I don't think that we as a profession were failing anyone, but patients weren't able to access NHS dental care. The right patients were not able to access their care. And you can see that in the east of England, there's a darker shade of red on that. Now, this table here highlights numbers. Now, these numbers are, the bottom is a cumulative total from dental access centres within east of England, or East Anglia specifically. This number represents patients that were turned away from dental access centres. These are patients that turned up to the access centres because they could not see an NHS dentist, could not get in, and they were not able to be seen in the dental access centres. So you can see in September 2017, and this was a kind of growing trend in that area, 707 patients that month, but we don't know where they went. We don't know if the data was representations. It was very basic data that was collected. But we did know that there was an increase in MP letters, complaints, Health Watch, and for me, I work in secondary care, and there was a surge of patients turning up to A&Es, which is not real good use of the NHS funding. Now, I've marked on this map the dental schools within UK, and these are undergraduate and postgraduate. And I've zoomed into the area that I was working in, and you can see that this is completely absent. There's no dental school there. There's no dental university. And that poses an issue when we're thinking about workforce, when we're thinking about retention of our workforce. If we've not got professionals training in an area, they're not going to stay there. So we're relying on people wanting to come to a region because they've got the opportunities or they can see something within that area, or we're relying on people coming from schools and wanting to come back to their hometown. But if they're not training in that area, if they've got no need to go there, why would they suddenly take a job and settle there? Now that poses a problem with regards to our workforce, because if we don't have workforce in these areas, how do our patients access the care they need? So we started doing work pre-COVID, collaboration between the local dental networks, NHS England and Improvement, Health Education England, and we looked and sat down and thought, what can we do here? This is just a letter that we put in the BDJ, and it's a programme called Inspiring the Future, still exists, and it allows professionals across every profession actually to go to the grassroots, to go to these schools in areas of unmet need, privileged areas, anywhere really, to talk about their careers, talk about the profession. And we really thought that going to the grassroots areas and speaking to school students who are at that stage of thinking about what they want to do with their life, this is something that can really encourage people to maybe come back to that area. But I move on to innovation, and this is the first I that I'm going to talk about. So I'm basing this on integration, but innovation and inclusion both come hand in hand with it. So we need to think about innovation, and the panel discussion was talking earlier, we were highlighting the talk about the careers, portfolio careers. So I teach undergraduate dental students in King's in London, and I also supervise DCTs. And when you talk to them about coming to the end of their BDS, and from my own experience as well, they get to the end of this road and they look and they say, what is ahead of me? Either GDP in primary care or specialised. But actually, if anybody is familiar with Spaghetti Junction in Birmingham, this is a little bit more what it looks like. And we spoke about, this was highlighted earlier, there's so many different opportunities, there's so many different development needs that we can have for early careers dentists, and even dentists that are at that stage of the profession where it was raised earlier, they might be understimulated, they may be looking at other options. So we went out the dental foundation schemes within our area, and we spoke about potential opportunity. And it was a programme that we thought about delivering, but there's no point delivering something and putting these opportunities in front of people if they don't want them. So we had to clarify, what is it that you want in terms of your opportunities within workforce. So it was a part-time, 3 days a week practice job, salaried, with 2 days into a placement of the individual's essentially choice, interest. When we have our conventional training post, dental core training, we have a very not flexible model. You go into that's what you're doing. Yes, you can choose to a certain extent what area you want to go into, but you have to follow that. You don't have that degree of adaptability and flexibility. So we went out, and 83% of the actual dental foundation trainees said, yeah, they would be interested in staying in the area because of that opportunity. Now, the 17% had essentially highlighted that it was due to personal commitments, family commitments, houses bought elsewhere, and that's absolutely fine, but it wasn't due to the opportunity. And they actually had stated if that opportunity was within the area that they were working in, they would be interested. So that's just a point to think about, and it's about the inclusion element as well of involving the people that we are delivering the education, the training and the development to. So we were so excited about getting this programme off the ground, and then COVID hit. And I don't need to tell anyone in this room the impact that it had on dentistry as a profession, but also with the suspension of training, with the educators being redeployed, the trainees being deployed. It really completely changed everything up. But it did make healthcare more as one. So in my personal perspective, the suspension of training and that element of that face-to-face clinical attachment, I mean, the dental foundation trainees weren't even seeing patients. That was their first year to really get the bread and butter. They didn't have that opportunity, so something was missing. But we didn't stop. We wanted to continue because the pandemic was giving us further opportunity to look at what we could do. And so what we did is we had funding, collaborative funding from Health Education England and NHS England for a 12-month fixed salary post, equivalent to that of a DCT, DCT1. So these early careers dentists wouldn't be looking at their peers thinking, oh, well, they're getting way more, or the peers in DCT wouldn't be looking at these dentists and thinking, they're getting way more, because people talk. And we looked at the purpose, the sole purpose of what we wanted to do. So what is it that we wanted to do? Well, we wanted to serve our local population. We wanted to integrate with the wider health and social care. I'm somebody that in a few years will be duly qualified in medicine and dentistry, and the disparity between the two professions, when actually, as we know, the mouth is part of the body, the oral manifestations of systemic disease are so evident. There's a clear disconnect here. And we wanted to improve access to NHS general services for the patients within our area, but we also wanted to provide some financial security and stability to our workforce coming out of COVID and coming out of their DFT year specifically. They are pushed into this system where it's target driven. Now, we're not taught that at dental school. I certainly wasn't. And that can be really, really pressure. I've worked in practice, it's high intensity, but actually even with them being in a COVID pandemic training year, that's even more of a concern. And so this was taking that weight off their shoulders. You don't need to think about that, you focus on the patient. And we placed them 2 days within a health and social care environment. So initially it was going to be within a hospital environment looking at oral surgery development, because that's what these dentists were really keen to do. But because of the cessation of routine dental care, we didn't have that opportunity, but it didn't stop us. And they actually were placed into these hospitals as a wider team. And it brings me on to the inclusion aspect and how important it is that we work collaboratively and we involve all members of the profession. So this wasn't us setting up a programme and saying, this is what we're doing and this is, you know, what you have to do. We involve the dentists within the programme. We involve the host practices. These host practices were nurturing these dentists for 3 days. We needed to ensure that they were part of what we were doing as well and not just tell them how to do it. And essentially, it really brings in that interprofessional education and working. So CAPE is a organisation, it's a charity-run organisation, but really focuses on that interprofessional education and collaborative practice. In the university that I work in, we do an interprofessional pain day with dental students, and they're in a room with midwifery students, pharmacy students, nurses, and it's case-based discussion on pain and how to manage pain patients, and it's a multidisciplinary approach. And this is something that's really lacking within the dental undergraduate curriculum, but also as we move on to interprofessional working, even within our profession and our own professional identities, this is something that more collaboration is needed. So I'm talking and telling you about all this wonderful integration, but before we implemented the programme, we had the opportunity to place foundation dentists during COVID into a deployment situation, but one which we supported them with the persona of the healthcare support worker. And from this data, we piloted our programme. So it's not that we just decided this programme will be great, we'll pop them in 3 days in practice and 2 days somewhere else. We actually had dentists within that somewhere else environment, and we took that data and the feedback from them. And this is a short video to highlight what they did.
We're dental foundation trainees from the east of England, and we've been redeployed to Watford General Hospital.
So during our redeployment, we've been doing clinical and non-clinical work. Clinically, we've been on the COVID wards, proning, taking observations, and helping out with swabbing the new admissions. And we've also been helping out with some research looking at the impact of COVID in dentistry.
I guess when we first got redeployed, I had about 100 emotions. The main one probably being a bit worried because we had no idea what we were walking into. We'd all heard all the horror stories on the news and things like that. But also it was quite exciting to actually be going in and doing something and not feeling like I was sat around with these transferable skills, not doing anything to help.
In our short time here, we've already learnt so much. We've learnt loads from how the hospital system and hierarchy works, to working with a multidisciplinary team, phlebotomy, and also how to write a research project in order to get ethical approval.
Sorry, was going to play that twice because it was so effective. So moving on to the next aspect of when we're doing these programs or opportunities is what is somebody's motivation and purpose. We're all human, so if you do not have a purpose or a motivation to be involved in something, it's not going to interest you. And it's finding the individual's motivation and purpose within the profession across all of the professional identities. Why did these 8 foundation dentists step forward? I don't know. There was a big survey went out, come forward. They all had different motivations and purposes, but this is Hanali speaking about hers.
So you know those numbers that you see at the end of each day on TV? One of those numbers actually hit home for me, and unfortunately my aunt passed away from coronavirus. So about 6 weeks into lockdown, I found myself in the situation where this great opportunity came up, and it was at the right time for me, and I felt like I didn't want to sit at home anymore, and I wanted to do my bit and help. I had the skill set to do something about it, and it's probably the best decision I've ever made.
So when we move on from that motivation and purpose, we also go back to the kind of outcomes and the purpose of this programme. So we took that data, we seen that this actually could potentially work, and we piloted a 12-month programme, which I'd highlighted earlier, open access publication. If you want more information, you can access it. And the quote on the right-hand side is from the host practice. Now, they are part of this. This isn't just about the development of the dentist or the dental care professional that may be in this programme. This is about the whole team. And you can see that it helped them as a practice, and without having that target-driven contract focused on this dentist, they were able to support them, and they must have liked it because they jumped on board for the next year. So they gave good feedback with this. Now, moving on to integration, really excited. I don't know where Rachel is at the moment, but she's got her arts presentation soon after mine. Flora Smith, Zara. I work with her in the humanities module at King's College London, where we implement the relationship between humanities, arts and dentistry. We take the dental students to Tate Modern, National Gallery, we incorporate that with oral health. But you see within this Twitter quote that she'd put up that unless we integrate further with the rest of the healthcare system, us as a dental profession are going to have that reduced professional role and purpose because we won't know where we fit in, and that's what needs to be corrected. We've got the strategic drivers that are started and being rolled out. We've got advancing dental care. We also have the integrated care systems that are coming into place, and that, you know, they're looking at serving that whole population approach. We've got the NHS long-term plan, which says that it's going to focus on the workforce, but it's not just a one-way system. It's not just about what do we gain or what do our dentists gain or dental care professionals. It's about what does the whole system gain. Now, this is a respiratory consultant at Watford General Hospital who hosted the Dental Foundation trainees, and this is her take on it.
Redeployment has taught me how transferable and versatile dentist skills are, because we've moved from the comfort of our surgeries and practices to this hospital environment, which is obviously very different from what we're used to. And even though we're not treating teeth anymore, we've still been able to help people and patients and help support the wider NHS, which is obviously very important, especially during a time like this.
The pandemic with COVID has really challenged West Herts and most hospitals. The relationship that we've had, where we've had trainees volunteering to come and join the healthcare workforce in the front line of COVID-19, has been absolutely invaluable. They provide technical abilities, and they've been able to swab and go into the ED department to support all our other staff. And I think our working with the dental trainees has brought more wealth to West Herts than the other way around. But we do hope that this relationship continues.
So what's the impact of our 12-month programme? So we've seen the impact of placing these dental foundation trainees within a health and social care environment. We took the benefits from that and we created the integrated care pilot programme. Now, our main KPIs, or key performance indicators, were specific to recruitment, retention, access, delivering care. Now, from the recruitment point of view, it was a small cohort. We had 5 dentists in total. 3 of them were doing foundation training within that area, and they stayed after the programme within the practices they were in, actually, to serve this population. And that's retention and recruitment. One dentist we managed to recruit from a completely different area, and she then bought a house, and again, she's staying in that area. And the last dentist we supported on her career journey, she didn't get into dental core training prior to the programme, so we worked over that course of a year and supported her to get to the stage of her progressing. And so even though we didn't retain or recruit her into that area, we had her for 12 months providing care. Now, in the cumulative data that we collected, it was over 3,000 patients that were treated from these dentists. If they weren't there, who would have treated them? I'm not sure, I can't answer that question, but that hit the mark of these patients who needed care. And it was NHS care that they were providing. We worked to develop them. These are early careers dentists that, wanted to develop their skills. They developed so many different skills and were part of different programs. Within the middle table, you can see all the different roles they had. They became lead vaccinators. They were leading on the vaccination programs in the hospital. That is first year associate dentist leading the vaccination programs in a hospital. That's incredible, right? We had them delivering talks, presentations, developing their communication skills, building their portfolio. And the beauty about this is it's not a training program. It doesn't have a training number attached. So there's that flexibility, there's that adaptability to each individual's needs. Now, I know it's not sustainable for us to do that for every single member of the profession, but actually if we all work together and we look at the development of the profession, that's where these programs can come from. Sustainability, okay, great, we did the program for 12 months, then what? Well, we managed to approve funding for a second cohort, which is going on just now, and we are soon to be starting the third cohort, starting September 2022. So where are we now? Well, we're kind of moved forward. We're sitting in this room, but we're still at the same situation. We're still having the same discussions. I took this from a book. I can't say the word because it's a naughty word, but it's No BS Leadership. And it's a really good book, and it highlights essentially what we want to do. So where are we today? Well, that's pretty easy. You can just Google dentistry and it'll probably come up all the issues. Where do we want to be? Well, we know, we've been talking about it today. We know what we want to get to. That's also really easy to define. But the most difficult part is getting there. It's the complexity, and that's where integration, inclusion, innovation, collaborative practice, every single person in this room needs to come together for it. We're looking at new ways of working. That's the innovation side. We've already started that. We adapted so fast within the middle of a pandemic. We looked at virtual, we had to set up hubs. We can do it, but we just have to work together in doing it. I know Dr. Nishwood just spoke yesterday really a lot about EDI. That's an also important part of what we're going to do with inclusion. You've got the health and well-being, the psychological safety of our profession. These are all discussions that have been brought up. And we really need to reimagine. We need to reimagine what dentistry is and where it sits. We need to break down the barriers that we have, that imposter syndrome of what is dentistry and healthcare. It is healthcare. And the transferable skills. You've seen one of the trainees in the video talk about not just teeth. It's so true, but the public perception often don't see that. Cohort 3 starts September. We're now moving to a multi-speciality placement. So we will tailor that to the individual's needs. And it sounds like a too good to be true, but we do that. We do a PDP with them. Where do you want to go? What do you want to develop? Let's get you in there. We've got loads of collaboration from the host practices, the placements. The dentists are normally really keen, eager, excited, people who want that opportunity. And it's unique, but it's not so unique to our area. Yes, we have done it in that area, but it can be extended. And I don't know if Warren's still here, but I believe that CDO of Wales has now, taken this to the Welsh government. And I think that they're looking at implementing this across Wales. These programmes don't happen without the key stakeholders, without the key people. So I have to define that this programme would not have been possible without everyone on the screen, plus everybody else that was involved. And just like the previous presentations, I'd like to conclude by summarising that, you know, we've spoke about all the I's, the inter, intra, inclusion. I'm not going to run through them all. And we're looking at a new model of dental education. Is it a new model, or are we developing further models? It's not just a new model of dental education, it's a new model of care, organisation, collaboration. And this quote is really relevant, and I'm going to read it because it's really relevant to us. Now, this quote is from a dentist now who graduated from Harvard School of Dental Medicine. And he says, we came together through education. Every single one of us in this room, regardless of where you work or what your background is, we all came together through education. Introspection, we've had that with COVID, and we can't lose that. But most powerfully, we've came together through collective action. So even though some of us don't know each other in here, we've actually all worked together through the pandemic to actually get where we are today. Uncertainty was our catalyst. We did do everything that people probably didn't think we could do as a profession. We set up hubs, we overcame COVID, and we're still overcoming it, but we did a lot in order to be able to provide care which people probably thought we couldn't. And I think what we can't do is go back, and we need to look forward to make the world better, but actually to make our profession better so we can care for our patients. Thank you so much, and happy to take questions.